Hello, I'm Dr. Olivia Newby, family nurse practitioner certified in telehealth. I am here to talk about the phenomenal change of telehealth. Telehealth usage has increased significantly. Telehealth has been around for a very long time with significant improvement for healthcare providers in rural areas. However, telehealth had multiple restrictions and therefore being a barrier for usage. Telehealth now is the new kid on the block that has moved to first place in line. But one of the things many healthcare providers talk about is how to effectively perform a telehealth visit to ensure quality of care for their patients. So let's get started on the new rules and how to effectively utilize telehealth in patient care settings. Prior to entering your telehealth visit, colleagues, you want to make sure your proper attire. If you normally wear a white lab jacket, then this is appropriate to continue wearing it. If your patients are used to seeing you with the jacket, please continue. But if you haven't been wearing a jacket, just other attire, continue because that continues with how they have already perceived you. If you're wearing your jacket and or another attire, make sure that you have your identification or your name badge. This also ensures the patient HIPAA guidelines as well. Make sure you wear neutral colors. Plaid stripes can be a distraction. Your office background should be appropriate. Please avoid all personal items. Your desk should have appropriate items such as the computer, your chart to show you are ready for the visit. You should not be fumbling, trying to get your stuff together once we turn and get ready for this visit. Let's go back to making sure that we do not consume any food or drink. But if you have to have a drink, let's make sure it's something, a bottled water, that they can identify that you are consuming. All of these measures sets the stage for an appropriate setting for a telehealth visit, attire, background, and what you're eating. Let's go over our checklist for this visit. We want to verify your telehealth device is working properly, that you can see yourself, that the patient do not have to wait for you to plug something up, position it, get it together. If that is the case, that will delay and another distraction. Frame of the camera, make sure your position is in the center. You're not over here, you're not over there, and you're not too close. All of these will take away from your professional visit. And I also went ahead and put up, avoid being in front of a door. That can be a distraction, people walking back and forth. And also, it sets the room up for making sure they're secure for privacy. You also want to make sure that the privacy gives you and the patient that comfort that what they're getting ready to talk about is between you and them. Minimize potential interruptions. That includes your personal telephone, the office phone, anything that was distract from your visit. Because if that phone rings, what do we typically do? Answer it, another distraction. Now, let's get ready and set up for the actual telehealth visit. We are all ready. The room is ready. You are dressed. You have your desk appropriate. So the patient, You want to make sure you introduce yourself. Hi, I am so and so. I will be conducting your telehealth visit. You want to also at this time confirm that they have already signed for this telehealth visit, disclosing their consent. Second, you want to confirm the patient, his demographics, her demographics. You can ask their date of birth, have them spell their name, whatever is your typical means of ensuring that this is the appropriate patient. Next, let's establish a rapport. You want to introduce yourself, tell them what the telehealth visit is about, establish what to expect, establish that if they have any questions, anything to make sure it's a visit that will ensure continuity. I also, again, like to remind the patient how telehealth works. Explain it to the patient, how long you possibly expect, where you should be, and again, the telehealth guidelines. One other thing is the expectation. As that clinician, most often we are typing during the exam. You want to tell them that I may look away from the camera because I may want to type some information they're telling them. That ensures that I'm writing all your details, or I may need my computer screen to look away to get additional information or to look up something for this visit. And finally, your facial expressions and emotions. You should always have a facial expression of empathy, not of hurry, not of frustration. You should make sure that this patient is comfortable with the telehealth visit while maintaining professional behavior. Patient items for the exam. If this is a chronic visit or acute visit, it is appropriate to have medications that they are already taking available at the visit. Medical advice. Depending on what type of visit this is, you can also have the patient, if they are coming for a chronic hypertension visit or anything that you have related to blood pressures or any other chronic disease, and they may already have a blood pressure cuff, have that available. You can ask them to take their blood pressure reading. If it's a congestive heart failure or a visit for other means that you may need their weight, that will be available and they can provide that numerical number. If this is a COVID focused visit or something of that acute status, clinical, they may have already been taking their temperature and you can get them to pull the thermometer out and show you the reading. If this is a patient that is coming for diabetes management, appropriately to have all of their glucose readings, or if they have a continuous glucose monitor, have those numbers available. So when we do the HPI, we will have those numerical numbers available. And if it's a remote monitoring device, that as well. Now, the telehealth interview and the physical assessment. We always want to make sure we have appropriate open-ended questions. That is a way to ensure that we get all of the details during this visit. You can take that next component of looking at the general appearance. If this is a COVID patient or a patient with a respiratory acute episodic visit, you can look at the general appearance. Are they fatigued or appear ill? Those are some of the appropriate indications that you can clearly document. You can show them how to take their pulse, and you will tell them to speak each time they feel a beat, and you will count. So that will help you in making your assessment if their degree of distress, their pulse rate, and the respiratory. You can tell them You're going to count their respiration and you're observing, are they hyperventilating, hypoventilating? Are they coughing? How is their respiratory? Do you hear if they are complaining of shortness of breath with at rest? You can have them count. There's another mean to do the physical assessment. Their voice, is it hoarse, raspy, the pace of the voice, skin tone, particularly if this is a derm visit. You can take their smartphone, have it directed at the area of concern, and include that in the visit. If this is a visit that is another chronic for congestive heart failure, or you're looking for edema, have them direct, or the caretaker direct the camera to the area of concern, the lower extremity, or whatever, based on your clinical assessment. These are just some tips. And if you have the patient and you want to talk about you can look at their eyes. You can have them like me, remove their glasses, have them look up, down, to the left or right. And guess, that is can be included as your neuro. Same if you want to look at their oral. You can have them open their mouth but move in closer, or have the light on as well. These are mechanisms that you can fully incorporate a telehealth physical assessment appropriately. Patient shared treatment plan and follow. You have just finished a shared telehealth visit that is a patient centered care approach. We're going to discuss the care, then summarize the visit with the patient and or caregiver, listen for any miscommunications. You will be able to provide patient education, typically through your patient portal. And finally, you want to also make sure they can have access to their health records to refer back to later. And then we want to clarify any concerns that may have occurred during the office visit. And then finally, schedule a follow-up. With that, that should include all your telehealth components while ensuring a professional yet quality visit. And thank you again for being attentive to the telehealth tool of change.